Thank you all for joining today's session. I'm Nikia Wibode. I live in Germany and I work here as well as a procurement manager. I hope I'm very audible. I work as a procurement manager here in Germany, and on the side, I also own a fashion business, and that's the one that bears the House of Mothers already seen on the flyer. And today with me is Mrs. Oluwakemi Opeodu. She'll be let's say teaching us the types of birth control for men and women. And she would, be educating all of us about the full range of available methods of birth control, how they work, who is supposed to use them. And then if there's anybody in the audience who has questions, you can signify, you can raise your hand and we'll take the questions. Thank you. So I'd like to hand over to Mrs. Opeodu. I'd like you to please introduce yourself shortly.
So good evening, everyone.
Good evening.
Good evening. So my name as our moderator has introduced, is Oluwakemi Opeodu. I work as a microbiologist in Calcium Clinicum, formerly Calcium Clinicum in Cottbus here, now Medizinische Universität Lausitz. And like she said teaching. I don't think I'll be teaching us because I'm sure every one of us has like an idea on what contraceptive is. So I'll just be sensitizing us, or it will be more like an awareness or something we just want to discuss again on contraceptives for men, for women, the methods that are suitable for us. So that's just basically what we'll be doing this evening, sorry.
Yeah, we are used to the workspace environment where you have to work in the mornings.
Yes.
Gotcha. Yeah, thank you so much. I would like us to move straight in questions. So I'd like to say, you said you will be sensitizing us, but it's still, for me, important that we begin with what birth control truly is. Like, how would you define it to a layman? How would a layman be able to understand this? Like the simplest form of explaining this.
So when we say birth control or contraceptive, we can just say contraceptive is any method or a device or a medication that is used to prevent pregnancy. Layman English, stopping sperm from fertilizing an egg. So basically, that is what birth control is, or that is what contraceptive is. And yeah, if it's just a definition, that's what I would say contraceptives are, or what birth control is.
Yeah, and thank you. Would you say that this is something that's important for every family, or it's a choice? Do you think it's important for every family to go through contraceptive measures, or if you choose to, you can do it, something like that?
Well, it's not, I would say it's a must. I would say it's a choice, because it's something you and your partner have to decide to do. If you're married, like I would say, pregnancy is something we should discuss amongst married people. So if you're married, it's not something the wife has to do by herself or the man has to do by himself. You guys have to come together and conclude or discuss on contraceptives and what method is best for you guys. And I would say, I would advise that birth control is very good to do, or like very good measure to take, because in marriage or in life generally, you have to think about your finances, spacing your children, career, and all of those things. Even your body, like stressing the body to have children, is also something to put into consideration. I think those are like very important factors of why we should do birth control or make use of contraceptives.
Yeah, in the light of like you mentioned now, your body, I feel like a lot of people believe that it's the woman's nature, or the woman's body is already created such that it would conveniently go through pregnancy, go through childbirth, go through motherhood, and it's not a big deal. Do you think it's then not a big deal? I mean, because the way you stressed it out now makes me feel like, oh, maybe it's actually a big deal, and women need to now, hold on to the "my body, my choice" thing, and then maybe women then have to say that, okay, I don't want to get pregnant because I'm not ready, or my body is not ready, or I just don't feel like it. Will it not even start looking like you're selfish? And then your partner is just feeling like, oh, I want another child. It's not the one who is going to carry it. You who is going to carry it is feeling like, I'm not ready. But maybe the other person or whoever it is outside influencing your decisions to give birth feels like you're a woman, that's what you're created for. It shouldn't be a big deal, you know what I mean?
So I feel like this is very controversial, but then this is where I would say what I'm going to say from now on this particular question will be my opinion.
Yeah.
And I would say that it is a big deal. If your body is not ready, your body is not ready. I understand the concept of Christians saying, "Oh, we are supposed to give birth like the Hebrew women," but there's a lot of things going on in your body with pregnancy. You're carrying a new human. This person is developing cell after cell after cell after cell and growing inside of you. This person is taking his or her nutrients from you. It's like a rigorous thing for your body to go through. Your body is going through a lot of changes at the same time, hormonal changes, mental changes, physiological changes as well. So it's a big deal. Pregnancy is a big deal. And then when you say your body is not ready, I understand that there are some women that give birth easily, vaginal birth and all of that, and it just comes natural. Good for them. The Lord is faithful. But there are some people that cannot go through that stress. There are some people that cannot even, that have this very tiny pelvis, for instance, and they always have to go through surgical operations to have their children, cesarean section. So it's not a thing of selfishness for a woman to say, I am not ready. Or the previous pregnancy I had was rigorous and stressful. I want to take time to heal,
yeah.
get better, not just heal, in fact, physically, because your doctor will tell you usually 6 weeks after birth, you can go back to having sex and all of that. But then there's psychological healing, there's mental healing. And there's something that happens. I don't know. I think we're digressing kind of when we mentioned vaginismus, like secondary virginity after having a child. Because your body just closes up due to the trauma you have gone through in pregnancy. So I feel like all these things still boils down to the reasons why contraceptives is good, because you can accidentally get pregnant again.
Thank you. So let's quickly go to the available methods of contraceptives as well, birth control. I've learned that there are some that are hormonal, some are non-hormonal, but would you please expatiate on this?
Okay, so when we talk about contraceptives, we have hormonal methods, and then we have barrier methods, and then we have non-hormonal methods. So under hormonal methods, we have pills, we have IUDs, we have the implants, we have the injections, and I would say that for these hormonal ones, they are easy to go to. For instance, like the pills, it's just something you take every day, but it requires commitment. So if at any time you break the routine of taking these pills, there's very high chance that you get pregnant. And then the implants that you have in your arm, I think that's the one that's really popular in Nigeria. The implants the one you take in your arm, it lasts between 3 months to 6 months and all of that. Or you renew them every 3 months or every 6 months, depending on the one you take. It affects you. I would not lie. That one gets you very bloated, fat. It affects your menstrual cycle. And all of that. I think I also mentioned the IUD. Now, under IUD, we have some that are hormonal and some that are not hormonal. Like the Mirena, for instance, that's the one that is predominant here in Deutschland. It's hormonal. It's this plastic copper. It's in this T shape. It's plastic form that is inserted into the vagina and takes this minor procedure to and then we have the non-hormonal, which is the copper T. It's a copper. It's also in the T shape, but it's not plastic. The Mirena is plastic, but the copper T is copper. Metal copper, and they don't really. You can use that as well, but they don't really advise using it because it can puncture the uterus. It's a metal. It rarely happens, but it's something that can happen.
The disadvantage.
So that's that on hormonal contraceptives. Then for barrier contraceptives, we have condoms. Condoms is widely accepted, is the common one that we use, and because men can easily use that. We have condoms for women, but I would say women don't really use it, but men use the condom. And I would say that condoms are like the only contraceptive that can prevent pregnancy and prevent STIs. Others can prevent pregnancy, but condoms can prevent, and it is not 100%. Please don't quote me. Condoms are not 100%. They're not 100%.
I was also coming to the question about the effectiveness rate of all of them.
It can get busted. It can be punctured deliberately by someone that wants to get pregnant, So there are many common.
Can it also be punctured by the man, maybe?
Yes, maybe if you want a child and you guys have chosen to stick to condoms and of contraceptives. So, of course. So then that's that about that. And then we also have when we say non-hormonal contraceptives, sometimes we just mention the copper T, forgetting that we can talk about vasectomy for the men or for women as well, or complete removal of the womb. So yeah, tubal ligation is like the tying of the fallopian tubes, and it's a serious. I won't say serious. It's a medical procedure that can be surgical procedure that can be done, same as vasectomy that can be done for men. So, and I would say that those ones are permanent contraceptive methods. Like they can fully prevent pregnancy, but for men it is reversible. But it's also like another surgical procedure to reverse the vasectomy. And then we also have natural methods, natural methods like withdrawal, which I do not advise because I am a victim. So, like, it's not something we're supposed to mention as a contraceptive method, but it is what people do. So we can also say it is a means of contraceptive. So withdrawal method can also be said to be a contraceptive method. And then I don't know, some people use this. I don't know, this castor seed. I've heard of that in Nigeria. It's I don't know, they chew the seeds maybe once a week or once a month, and they say it prevents them from getting pregnant. I don't know.
It's not scientifically proven.
Yeah, well, I have a friend that swears by it that is what she uses, even though she now has 4 children. But then again, I don't know.
She could then say that she planned the 4 children.
Yeah. So, but so that's that about the types of contraceptives that I have that I can.
So in answering, thank you. In answering this question now, you've been also able to identify which contraceptive is
effective,
and also which one belongs to the female and then which one belongs to the male. So I have a question. Apart from the condom and vasectomy, are there any other types of birth control for men?
That I know of, there are some pills that are in clinical trials. I don't know if they're readily available yet. And there are some gels and things like that. I think people are using it, but they're experimental. So I would go as far as to say that yes, they are contraceptive methods. But there are pills that are being researched upon that men can also use, because I know a lot of men are running away from the vasectomy thinking they're going to cut off their...
Yeah, because everybody feels like it's permanent, and what if in the future you need to have more children?
If one time in the future you want to have children, it's just that you have to go through another surgical operation.
Wow.
Procedure to get it reversed. So yeah.
Okay, thank you. Now to another question. What would you advise? Should it be the woman that should be saddled with the responsibility of going through birth control measures, or the men? Asking this based on the fact that I was discussing with someone recently, and a man, was saying it may actually make more sense for the man to go through the birth control measure, because the women are already saddled with menstrual cycle. They are saddled with PCOS. A whole lot of stuff are happening to women, all the mood swing that comes with all of these things that we go through every month. Should it still then be the woman? Because I remember that at one point when I was thinking about going for pills for birth control, the explanation I got was I just felt like, oh no, I don't think I can do this, because I just tried to sit down and calculate how many days of the month the woman goes through the period, not the menstrual cycle, because the menstrual cycle is ongoing all of the time. So the period, and then you still tell the woman that because she wants to do birth control measure, she has to bleed for I don't know how many days. I cannot remember anymore. She has to bleed, and then after so the calculation, after the last day of period, you use the medication, then I'm not sure I have the correct information again, but I'm just saying that there's the part of the period, and then there's still also the bleeding. How much blood is left in the woman's body? Because I know that growing up, my mom even always told me that, oh, you should be using iron tablet or I don't know, medicine, just so that immediately after period you should be using it so that you'll be revived and all of that. And I don't think I've ever remembered to use iron tablet. And then now thinking about having to bleed again, it's already too much stress. What do you think? Should the men do it, or the women be saddled with this responsibility again? After you answer, I have one more question to add to it.
I wish this question was asked in like a we are in the Western world, but if it was like a more westernized audience.
I know, right? I think it's mostly that. Okay, yeah.
Yeah, we have this is an African audience. So really, like what that person said, the woman is already saddled with a lot. Pregnancy, the period of pregnancy, the postpartum period, menstrual cycle, PCOS, although it's not everybody, but it's also part of your ovulation period is also part of your menstrual cycle, the mood swings, everything, and we are saddled with that. So I don't think it is wrong if the man decides to, oh, I love my woman so much and I don't want her to keep going through pains, because most of this, some of the hormonal IUDs, it worsens the symptoms you have during your menstrual cycle. or during the menstrual period, it's them you have worse mood swings, terrible cramps, sometimes irregular menstrual periods as well. Go as long as 2 weeks, 7 weeks. Then you see this month, the next month you don't see it at all. Like there's so many things that come with it: the uterine shedding, the excessive mucus discharge of ovulation, and all of those things comes with this. So people start having bad odor, like excessive sweating, because it's hormonal. So some get very fast, and then you try everything you can do, and you're not losing weight. There's so many things that comes with these contraceptives for us. And for the man, if you just snip it, the vasectomy, then it's you can have as much sex as you want. You can do it as much as you want. And I personally would say that it's best if the men take that up as something they are willing to do, as like a sacrifice they are willing to take for the family or for the marriage or something. Yeah.
Okay. So it brings up the question again in my thoughts about what the society expects. I feel like the society expects that it's the woman that should go through this process, or should we say that it's the woman who is maybe afraid of getting pregnant mistakenly because maybe the man didn't get the correct condom, or they bought the cheap one and then it's maybe already destroyed, or maybe the man says, oh, I'm getting the vasectomy done, and then
and it doesn't.
It doesn't. I'm just looking for like the wildest reasons right now. I mean, I feel like some women feel like it's because it's my body, and if anything happens, if I get pregnant, I'm the one whose life is going to be on pause. For example, those of us living here abroad, you know that when you get pregnant, at least 2 years of your life is almost, for the lack of better words to use, wasted, because this gap in your CV or whatever it is, a lot of people feel like that pause is something that's, it may be so difficult for you to like retrieve. So the woman then probably feels like, no, I don't want to go through all of that stress. I don't want to stay back at home when my husband is busy making things work out for himself. Or thinking about the fact that here in Germany, a lot of people are now talking about pension. If I stay at home for too long, every time, oh, maybe I get pregnant today, next year I get pregnant again, in 3 years again, I'm already pregnant again. And then if you actually think about things like pension, you don't actually want to do that. Or maybe someone who just got a job, you obviously should know that you need to pass your probation, be sure of your workspace, be sure that you are already duly employed, gainfully employed, before you say you want to probably get pregnant and all of that. So if the woman looks at it in this perspective, I feel like a lot of women would choose to go through these birth control measures so that they are sure, they are safe. They feel like, okay, it's in my body, although it may be tiring, although it may be a lot of weight on us. Do you get what I mean? So should we then say that it's the society that has already brought it out to us, or it's we, the women, who just say that, well, let me be on the safer side.
I will say that
I'll do it myself.
I will say society has conditioned us to be like that. Because that currently is our reality. I would say I chose to take the IUD because I don't want to go through another. I had my kids back to back, and I didn't want to go through that anymore. I want to be able to plan my life, get a career, work, and all of that. So I chose to do that because I know that my partner was not going to be ready at the time to get it back for me, and I wasn't ready to, so it was easy for the decision to fall on me to do that.
Yeah.
But like I said before, that was my opinion. Like, it would have been really nice if our men decide to shoulder that, but our reality is not that. Our reality is we have gotten to a point where we have to choose ourselves. The reason why women today are just, I don't think they will even really think about it. When you mention the contraceptive methods, the only thing they will discuss with their husband is, should we choose condoms or should we choose IUD? Or should we choose, do you understand what I'm saying?
Yeah.
Like the easiest option for the men to go for would be the condoms or withdrawal. And for women, you would not want the withdrawal because anything can happen. It's just anything. It is not the entire sperm. In fact, what they call the pre-com is enough. It's just a single sperm that has to fertilize for you to be pregnant. So it is not a sure way or a safe way to.
Or the calendar calculation too.
Yeah. So you see, it's something that we should like take away from here. Let's think about ways we can help our significant others, like reduce this burden.
Yeah.
So I feel like women choose to do that because our society has conditioned us to think for ourselves, to choose ourselves, because when it comes down to it, when you get pregnant, you are carrying that pregnancy by yourself for 9 months. They can only tell you, sorry, massage your leg.
How can I help you?
And all of that. And for the next 6 months after that, you are breastfeeding the child, your body's going through changes and all of that. And it is all you. They can only sympathize with you. So I feel like that's it.
Okay, thank you. I was going to ask about the permanent and reversible methods, but you already answered that, and which ones are safer to use. So I'll just ask one more question. We are fast, almost out of time, but I'll just ask one more question. Should we go to the internet? As everybody says that anything you're looking for now, you go to Google, you're gonna find it there. Or should we go to ChatGPT? As is the AI what's it called? Let me use the word machine, where you can ask a lot of questions and you get responses from. Or should we go to the hospital to ask these questions? Because, for example, the hormonal ones like this now, or the non-hormonal ones, what if it will not be compatible with me? Like, how do I know which one to use? Who do I actually go to, or where do I source information?
Exactly. So I would say it's not wrong to go to the internet. It's good. I would say that whatever you're walking into, especially here that we're in Germany, and then for us or most of us here, German is not our first language. And then you're going to your gynecologist and you're going to be listening to what she's saying, and you're not getting every word saying or because you could also have a male gynecologist. Excuse me. So it's good to inform yourself. But I wouldn't say that you should act on the information you get on the internet. So now you inform yourself and then go to your doctor with the information you already have and then compare notes. For instance, it is not everybody that can, like I said, the hormonal IUD has side effects, because you have hormonal imbalances, it disrupts your cycle and all of that. But the copper T that doesn't, it doesn't affect you, it doesn't affect anything, it's just copper. It is not everybody that can take it. People can be allergic. And so people can have what we have, cervical incompetence, or this very, very, very thin layer of your uterus is not strong enough. So there's very high chance that it can become perforated. So dealing with medical history, your gynecologist has your medical history, and then she would advise you on what is best or suitable for you. Do you understand? For somebody that has I know this is a reach, but for someone that has like kidney issues, for instance, and they choose to be taking pills, and the funny thing is, the ones there's this pill that you have to take every day consistently. So imagine taking
that's the one I was mentioning the other time.
5 days every day, just because you are trying to avoid pregnancy, and it is also hormonal. So like all those things, like you have to weigh them, check and balance. So you can go on the internet, read about it, inform yourself. And because like IUDs are quite expensive, your insurance doesn't cover it, so you're going to have to pay for it, and it's always between 350 euros to like almost 500 euro. So yeah, you might feel it's expensive, then you go for the pills or you go for the implant and all that, but all of them have their side effects, and then it also depends on the one that can work with your body.
So I cannot ask my friend, which type are you using? Let me go and tell the gynecologist, this is the one I want to.
Well, the doctor can only advise you. They can't force you to do whatever. I would say that that's the advice from your doctor.
Okay, thank you so much. It's been really nice speaking with you. I don't know if there's anyone who has questions for our speaker today. Thank you very much. Bio Day. You may ask your question.
Yes, thank you so much, the presenter. Please, I have 2 questions. The first one is, in all of what you've said, do you think it's actually worth it to have these discussions between couples, or just let it be like the natural state? I mean, but birth control discussion. If we are like putting everything in the status quo, the nature-based approach, do you think it's okay then just because eventually you mentioned several implications, hormonal imbalance, whether you do it, whether you consider one hormonal platform or the other IUDs, whichever approach we use, we can have hormonal imbalance. And for the male, which is vasectomy, it's more of an implied responsibility, in my opinion, and because men are wired naturally to have sex. So men are wired naturally to just whatever ways. So if it's our responsibility and we do that, then it's women's responsibility to regulate their watch over their cycles, reproduction cycles, lifestyle, eating habit, and all of that, to just ensure that the normal nature-based state remains the same. Of course, I agree with respect to the post-delivery changes, but we're talking about something that the body was designed for. So, which the moderators mentioned earlier as well. So, do you really think the discussion is worth it?
Okay, I'm going to answer your question two ways. I'm sorry, I do not want to be petty, but if we are going to do it like that, you are not supposed to be taking medications at all. When you fall ill, your body is supposed to produce white blood cells and fight off the infection by itself. And then you just wait it out without taking antibiotics, without going to your doctor and wait till your fever breaks. Do you go to the hospital when you're ill? Do you take drugs when you're ill? Why not allow the body just take the natural state and then fight off the infection by itself?
Several times you mentioned the society conditioned us that way. So you use that several in your presentation. So if I want to respond, I'll say we are conditioned to go to clinics for petty sicknesses. But our forefathers, like in every continent, were surviving through nature and all of the rest. So healthy lifestyle reduces the chances or possibility of going to clinics for certain things, other than at a certain age where it is just necessary to have because of the efficiency of the body organs. So, but if one checks the lifestyle, you might prevent some basic visits to the clinics.
Okay, I'm sorry to cut you short. I'm also going to say this. If we look at, when you say our forefathers, healthy lifestyle and all of that, if you look at the mortality rates of childbirth in those times to this time, are you going to say that, are you going to stay here and still say the same, or like give the same reasoning that you have given, let everything take its natural course? Do you know the amount of women that lose their lives while giving birth? Do you know how many people in those days, we didn't know what was called resource factor? And the woman will keep having miscarriages after miscarriages after miscarriages, and they say it's abiku. I'm sure you're Yoruba. So like there are so many things that we have to do away with. You also said something about a man's natural state is also always want to have sex. Having a vasectomy doesn't stop you from having sex. In fact, it gives you freedom to have it as much as you want. It doesn't affect your erectile function. It doesn't affect anything. And when you're ready, if you feel like, oh, I've had 3 kids and then I can do the vasectomy, and then you decide after maybe 4 or 5 years, oh, I feel like having another child again, you can always go back and reverse it. Like, this discussion is not something we should argue or fight over. That was just my personal opinion. Like I said, my husband did not choose to do the vasectomy. I did not even bring it as an option because, like I said, we have an African audience. So, and then, like I said again, we are conditioned to fight for ourselves. But I'll leave this with us. Speak with your partner or your spouse and decide whatever contraceptive is good for you. But I would not advise that you leave it to chance. Imagine a woman getting pregnant I am a Christian. I do not advocate for abortions because I know of some women that will get pregnant, and because they do not have the financial means to take care of that child, they abort the child.
Mm-hmm.
And then they get pregnant again and abort the child. And we have some women having like 5, 6 kids. In those days, they'll say our great-grandmothers had 13 children. Did they have the capacity to take care of all of them? You hear a woman say, she had 11 kids, 7 survived. They had 10 kids, 5 survived. And then in those days, the father goes to work, mama stays at home and takes care of the children. But the era we're in now, everyone is career driven. Mm-hmm. I'm married, my husband works, I work as well. So you can't place all the burden of a woman's natural state on me while also trying to provide for my family. I'm not saying I'm providing for like we are doing this jointly. I don't know if you understand what I mean. So I'll say this again. That was my opinion on the man doing the vasectomy.
Which is also the opinion of a lot of women, actually.
Yeah. So you still have to decide with your partner on what you guys want to do for yourselves. But leaving it to the natural state, I would even give another example. There's some women that have conditions. For instance, cervical incompetence. That when you get pregnant, you can only carry the pregnancy for the first 5 months. The heavier the baby gets, the weaker your cervix is. You already know this. You will get pregnant. You can get pregnant easily, but you already know this. And after that, you give birth to the child. What's the word now? Prematurely, and then it's left to God for the baby to stay or not.
Yeah.
And then you now keep going through the cycle because what? I want to leave it in the natural state. Do you think about the emotional torture, the mental torture, the body, the physical trauma, and all of that? So if you have the chance to be able to plan it out, we're not saying we are planning for God, but if you have the option, you have the opportunity to plan it out. Okay, for the next 5 years. In fact, all these contraceptives have durations. You have the implant of 3 months. So when you don't want it anymore, or you are ready to try for having a child, then you remove it and then try to start actively searching for a child or pregnancy. And if you don't want that one and you say, okay, for the next 3 years, I want to work, you can get the IUD for 3 years. You can get one for 5 years. There's one for 8 years. There's one for 12 years. They all have different durations that you can take. You just pick the one that works best for you, which is why you have to speak with your gynecologists and speak with your spouse. It is not something you do secretly. Like a man wants a child now, for instance. Oh, I want a child, and because you are tired. Like this kind of instance, like saying you should leave it to natural state. You just go and hide and do it. And you guys now go into your prayer room and be praying for a child together. You as a woman, that you have taken a contraceptive. That I do not support, which is why we also have to come to a level of understanding compromise. We cannot leave everything. Don't you love your wife? Don't you love your partner that you will say just leave it? I feel like we should. There's this thing like on a lighter mode. There's this thing that they do now on the internet. They get this simulation. Cramp, just period simulation, not labor simulation. No, I wish we can get it and try it for. They should know what period cramps feel like. You guys don't understand what it feels like to have period cramps. That's just period cramps, and that is something you have every month. Not to not talk of going through the labor pain. I understand that it is a natural thing for us to do, but if we can help ourselves to alleviate the pain, if we can help ourselves to make life easier for ourselves, why shouldn't we take that option?
Yeah, thank you.
I hope I'm able to answer your question.
Before you say something again, Mr. Bayo, I just wanted to also mention about if we want to think about how our forefathers did this, like you have mentioned, it's different. They had to go and fend for what the family would eat, while the was sometime now where everybody's eating almost everybody's eating processed food. People don't take as much vegetable as those people back then did. We would all wear out. And they always say this thing that when the man and the woman are working together and they're saying, is that your mom? Because the woman looks really old, whereas she's the wife. But she has spent the good part of her life giving birth, wearing out, just so that the society probably does not call her barren, or because she just wants to. It's I want to believe that a lot of women don't even get pregnant and give birth because they choose to, want motherhood at the time when it actually happens to them. A lot of women. You see some people, you'll be asking yourself as a woman, like, what's going on? That lady's pregnant, As a woman, just woman to woman, you'll be thinking like, is she really ready or she's not really ready? And if you ask some people if they will be very sincere with you, they will let you know that it was not planned. It just happened, maybe because of failed I don't want to say failed birth control, or let me say because they went through unsafe birth control method. You understand? So I don't know. I feel like we should not even compare ourselves with our forefathers. They're not even on the same. It's different. The woman is not going out to source for food the same way the man is going out. A lot of people nowadays. Let's look at those of us here in Europe and all of that. You are in Germany, you are working, husband full-time, wife full-time, and then you want to keep giving birth like that. Really, it's you may not be able to coordinate your life at the end of the day. And so, okay, maybe when you now finish and then you work for how many years, out of how many years, and then you probably go back home. Because there's really nothing. Where's your pension? It's not there. It's not there. I'm sorry, I'm mentioning about pension because I recently heard about pension and how public pension is actually not sufficient for especially women, because we take too much breaks to give birth. We take breaks to you are pregnant, you take break. You are breastfeeding, you take break. They will even tell you that you have up to 3 years in Germany to take care of your child and all of that. And some people will be like, flexing, enjoying the whole thing. But at the end of the day, it's actually going to tell in the future. So I don't want to really hold on to how our forefathers did it. They didn't do it like this, on a very serious note. They didn't put their women out there. In fact, I remember that my own father told my mom not to work. Stay at home, take care of the children. She was the one that was fighting him. I have a certificate, I studied. Why should I not work? Back and forth. Okay, she had a shop so that it would be a little bit flexible because he wanted someone who would be able to take care of his child. While he travels everywhere. If it were even now, you'd be like, why should I keep my own career in the ditch? And then you are the one who is doing all of the to and fro. You are excelling in your career or your business while I'm supposed to sit back. And it doesn't mean, no man wants to marry a dumb woman. You want to marry an intelligent woman. You want to marry a smart woman, someone who you can say, oh, that's my wife. But then, if you are now not going to be selfish, you will not say that, oh, leave her in the natural state, let her be giving birth. The Bible says you be fruitful and multiply. But at the end of the day, you have to still know how to plan your life such that people will laugh at you at the end of the day, like, what's going on in their own family? So, sir, we are removing the natural state thing. I don't know if you still want to say something. I see that you're muted. And I understand perfectly that you are not, or let me just say that I believe that you're not talking from your own perspective, but from the general perspective of men. So that we are not so direct at you, like we're having a war.
What I can make of the discussion from both the point from both speakers is that, of course, coming from women, too emotionally attached to the topic, and I'm speaking from a neutral point of view from what she's presented, which is having acknowledged that there is high tendency for hormonal imbalance when the birth pills are used. Then for the vasectomy, there is every possibility that when the reversal wants to be made, there is a possibility of not being viable for the sperms, not being viable anymore. So, and that led to the question of, is it really worth it? I think then when you make reference to the forefathers, I was talking about the natural state of humankind. So the natural state of human nature. So even in the Bible that you referenced, people planned. So if more of planning in the natural state might be more effective than the pills, because what you're trying to avoid is having kids as a result of sexual intercourse. But when you use the contraceptives, there is every tendency that it leads to another disease or situation in the woman over time. So when you talk about the overtime implication of these things, like irregular flows, blood clots, ectopic pregnancies, it could lead to that. So
I have a question, please.
Okay.
How do you plan in the natural? You say natural states of humankind. So how do you say you can plan with the natural state of humankind, like the natural?
Can I just quickly chip in that if we want to follow the natural state thing, then maybe people should not get married or people should not have sex, because that's what would keep all of us in the natural state.
Thank you.
I
also wanted to just ask this question. Can you please explain to us what you actually mean by natural state, so we don't misunderstand you?
Natural state thing.
Thank you. I think it's this is more of I expect the women to react this way, but the natural state is the man having sex with a spouse, and based on the preventive measures from the women, which is maybe like washing, cleaning of the body immediately after. I'm just saying, please don't be too reactive to that. I'm just saying that the natural state now, without any contraceptive being used. So if you're lucky not to be pregnant, so be it, and then you calculate yourself. You know when you're safe, when you're not safe. I think it's better from being considerate as a man feeling for a woman than now saying that you should go for these contraceptive plus, and at the end of the day, you have irregular flows, you have blood clotting, and it's definitely cervical cancer and so on. So, yes.
I'm sorry, please. Where did you get the notion that after having sex, washing up or peeing? Because I know you didn't mention that, but that's what people say. You peeing and washing up helps you prevent pregnancy.
I never said I'm not a woman. I'm just
exactly. You're not a woman. God bless you for that statement. God bless you for that statement. You're not a woman. That in no way prevents pregnancy. All these things are just myths. They are myths that people have come to believe. There's no way you say, okay, after I know people believe this. I think like they've been conditioned to believe this, that when you go to after you have sex, you clean up and then you pee and then everything comes down. It doesn't work that way.
Or you drink Schweppes.
Yeah, it doesn't work that way. Another means of contraceptive that we didn't mention would have been after sex pills. I think.
Yeah, morning after.
Morning after, exactly, like Prostino 2 and all of that. Mm-hmm. I know some people use that, they abuse it, that every time they have sex, I think it's common amongst unmarried people.
Mm-hmm.
And they use it immediately after sex. They abuse it because it's something that you should just use as a backup.
Yeah.
In the case of an emergency, where, for instance, someone that is on pills did not take broke the commitment she had to the pills, like the pills you're taking every day.
Or maybe in the case of maybe the
or maybe
the
you
condom
have
or something
exactly,
burst or
exactly. in the in the event
Yeah.
in the event of an emergency, that is when you use morning after pills. I wouldn't want to talk much on this topic that he has raised, because like he has said, you are becoming emotional about it. And
Yes,
you
I sorry. I also want to talk about that, about saying we are being emotional. I think that's a bit unfair. The reason being that I mean the women are basically the ones going through all of this, and the men just have to hear us. They It's only how we have to explain how we feel, what we go through. That's the only, I mean, that's the highest, that's the best way they can even try to fathom what we go through, because they don't go through it. And if you also say you are being neutral, I don't think that's also true, because you cannot be neutral. You don't go through it, right? You're only talking from what you see, maybe from your partner or from some women, and you see, like it doesn't just work that way, right? So we might take it personal, but you two, the men, you guys cannot really understand anything. So nobody is at the midpoint, right? I think like the only way, if we want to actually solve this problem or find a solution around it, the men need to allow the women to talk about it, and then maybe somehow if the men are willing to make some sacrifices, or basically the partners should find something that works for them, I think. But at the end of the day, I would also like to say that women are the ones I don't want to use the word the victims, because it is our body, right? Women die from childbirth.
Yeah.
It happens. So at that point, we are not thinking of what the hormonal contraceptives will do to us, because we are sure of what we'll go through from childbirth, right? But
Yeah.
the statistics show that maybe 2% that this, that, but we already know what happens with childbirth. So we are focused on solving what we consider the problem for us. So at the end of the day, it lies on the wind. I think maybe because that's why most women they don't care to know whether the man is doing the vasectomy or not, because we know at the end of the day we have to go through this.
Yeah. Thank you for your contribution. Dayo, your hand was raised.
Sorry, it's not Dayo. I
sorry,
think it's yeah. In addition to what everyone has said, and the comment from Mr. Bayode, it just kind of re-emphasizes the fact that there's a lot of things about women that men don't know. There's a lot of unlearning. Excuse me. There's a lot of unlearning. And the learning that was done by men on this topic is not proper education. It's from maybe what they heard on the streets, or maybe what someone that is probably uneducated also said to them, or something like that. So there's a lot of unlearning. You'll be shocked that some men don't even know what a menstrual cycle is. They don't know the kind of things that we go through. They don't know what period pain is about. If you are rolling on the floor that your tummy is paining you, are being dramatic.
Exactly. You're exaggerating.
Or when you're talking about postpartum depression.
You are exaggerating. You are just so there's a lot of unlearning and learning that men should actually go over and beyond to learn about these things, because now it concerns your significant other.
Something went wrong. Please try again.
Sorry. It concerns their own future. If you feel like you are ready, like you don't want to have children anymore, there are measures to take. And like you earlier said, the onus should be on the men to be like, okay, this woman has already gone through a lot of things already. This is just one. You'll be shocked that they don't want to go through any form of pain. That's the reason why they are saying that my mother did not do this, my father did not do this. Things have changed. Nobody should be comparing. I don't want to hear it. All those forefather stories, it just used to irritate me. I don't want to hear it. Things have It's different now. So men should just please learn, like unlearn the rubbish that was said in the past by uneducated people and relearn. There are too many information on the internet these days. And make sure you're learning the correct one anyway.
Maybe they're the ones that need to go to ChatGPT now.
Like unlearn, relearn, try to care more about your significant other, not more than yourself, but as yourself. Do you get to know that, okay, this person has gone through too much already. Let me also take some part of this parenting that we are doing together, or union that we are in together. Let me also take some pain from her, away from her, and stuff like that.
Thank you. One, your hand is raised. We should be drawing the curtains shortly.
Actually, I wasn't the one that wanted to speak. My husband wanted to talk about it, and since he's like the male gender, so I thought maybe
Okay. Yeah.
Yeah,
Surely welcome.
good evening, everyone.
Good evening.
At first I thought it was a women's meeting until I started hearing one or two male voices in the background, and
That's how all of you used to think that birth control method is for women.
please, I know talking to the women will be like preaching to the choir. I want to actually talk to my brother. I heard everything he said. I don't know if he's married. I don't know if he has kids.
Yeah, I think he's actually just pitching out what a lot of men think about this topic, not
Okay,
his
not what he
personal-
feels himself.
No, not his personal view about it.
Okay. Then there'll be no need to say anything then.
But of course, you can
No,
still,
I
because
was,
the recording is going to be on YouTube. It's going to be on so many other platforms, so
sorry,
everyone can learn from
moderator. Sorry to interject. I was speaking my own mind.
it. So,
So it's okay for you to respond to my view.
Okay. All right, sir. I think I understand what he meant by natural ways, and then not going the contraceptive way because of the side effects and all that. But this natural way you're talking about, there is nothing guaranteed about it. You could do all the calculations, calculate the ovulation day, calculate the menstrual cycle and all that, and it will still fail because the body is dynamic. The woman could go through stress this month, or there may just be something that will just change in her body in a particular month, and you'll be there calculating, oh, ovulation day should be so the while it has changed and you don't know. So their bodies can be very, very dynamic. The hormones and everything changes with a lot of things that happens around them. So you cannot be 100% correct about it, okay? And then the contraceptives you are trying to run away from, these things have been checked. I know they are not also 100% guaranteed, but they work with statistics, okay? They can say maybe it fails in 1% of women. That's good enough. 1% failure is good enough, okay? But this natural way you're talking about, you can try the washing and everything you said, and it will not work. In fact, it doesn't work. It doesn't work, okay? So that's a no-go here. And like my wife said, the effect of giving birth, the effect of childbirth, the effect of the risk of carrying pregnancy over and over again. If you check it, if you weigh this against taking the drugs based on the statistics or the success rates, you see that it's worth it to try give these contraceptives a chance. Okay, it's worth it. It's not the risk of pregnancy and all the stress women go through is not what's doing all the natural ways and those things we're talking about, because those things don't actually work. They don't work.
okay, thank you so much. Thank you for your contribution. We've really run out of time. A 30 minutes program has lasted up to 1 hour already. It's a very controversial topic, actually, and that's why we have decided to split them into different episodes. Just the first episode, and we are going up to 4 episodes. So it would be great for everyone to still join in so that we can have more views, more opinions. We'll be having the second episode next week. And we'd love to have you all around and then to contribute your opinions again. And it's been so nice having you all around on the call. Thank you so much, Mrs. Oluwakemi Opeodu. It was really great having you here.
My pleasure. Thank you.
Thank you. Yeah, thank you all. The recording would be put on the YouTube platform for everyone who would like to watch again or still have comments to put on the comment section. Anything that you feel like maybe you could have said tonight, you could put them under the comment section. We can continue to have the discussions from there. But as already said, we'll have the second episode next week. And I hope to see you all there. Thank you all. We'll draw the curtains here and hope to see you, as already said, next week. Have a very beautiful night and beautiful weekend as well. Thank you. Bye.
No.